Welcome to CPT Coding Guidelines Review, Injections and Infusions. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in your ability to code these procedures. The guidelines are waiting, so let's get started. Knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guideline Review covers the guidelines for coding injection and infusion procedures. So before we dive into the guidelines themselves, let's take a quick look at what injections and infusions are. Injections and infusions are methods of administering medications or fluids that for one reason or another can't or shouldn't be given orally. Injections are the administration of a liquid, generally a drug, delivered all at once, using a needle and a syringe. Injections are given intravenously, intra-arterially, intramuscularly, subcutaneously, or intradermally. Injections given intravenously or intra-arterially are sometimes referred to as pushes. Infusions are the administration of a liquid, such as a drug or hydration, in a slow and controlled manner. Most infusions deliver substances directly into the bloodstream intravenously or intra-arterially through a needle, catheter, or port, but infusions may also be delivered intramuscularly, subcutaneously, or epidurally. If you'd like more detailed information about infusions, the reference shown here is a good option for an expanded overview of these procedures. Codes for hydration, therapeutic, prophylactic, and diagnostic injections and infusions, and infusion of chemotherapy or other highly complex drug or biological agents are not intended to be reported by the physician or other qualified healthcare professional in the facility setting. The work of the physician or other qualified healthcare professional in relation to these administrations primarily involves affirmation of the treatment plan and direct supervision of the staff member carrying out the administration. In the physician office, provision of a significant and separately identifiable evaluation and management service in conjunction with administration of an injection or infusion is reported by assigning the appropriate E&M code and the code for the injection or infusion. Append modifier 25 to the injection or infusion code to indicate the E&M service was separate from the E&M service inherent in the injection or infusion procedure. If performed to facilitate infusion or injection, the following are not separately reportable: local anesthesia, starting an IV, accessing an IV, subcutaneous catheter or port, flushing a line at the conclusion of administration, and provision of standard supplies such as tubing and syringes. When multiple infusions and/or injections are given, only one initial service code is reported per given date, unless protocol requires the use of two separate IV sites. A second initial service code is not assigned due to the need to restart an IV, due to accessing a port of a multi-lumen catheter, or the need to use two lines in order to be able to reach the proper rate of administration. A key point of understanding for correct reporting is that if an injection or infusion is of a subsequent or concurrent nature, meaning it was administered after or in conjunction with the initial service, it must be reported with a subsequent or concurrent injection or infusion code, even if it is the first administration from within a group of services. For example, if a patient is given an IV push After a 1-hour infusion, the code for a subsequent IV push is assigned, because even though this was the first service reported from the IV push group of codes, the IV push service was subsequent to the infusion service. For physicians, the infusion designated as the initial service is the one that is the key or primary reason for the encounter. The order in which the infusion or injections are given does not influence which service is designated as initial. For facilities, designation of a service as initial is based on a specific hierarchy, which will be covered in a later slide. Both physicians and facilities may report only one initial service per given date, unless protocol or the condition of the patient requires the use of 2 separate IV sites. In those instances where 2 IV sites are required, the second IV site is also reported using. Sequential infusions are infusions of a new substance or drug, following administration of the primary or initial service. In nearly all cases, a sequential infusion requires that the substance or drug administered is new. There is one exception to this requirement for a new substance or drug, which is that facilities may report sequential IV pushes of the same drug. Add-on code 96376 specifically reports sequential IV push of the same substance or drug administered by the facility. A concurrent infusion is the infusion of a new substance or drug at the same time as the infusion of another substance or drug. Concurrent infusions may be reported only once per day, regardless of the number of new substances or drugs administered concurrently. Hydration may not be reported as a concurrent infusion. Separate subsequent instances of concurrent administration of another substance or drug are also not reported because, again, this service can only be reported once per day. When coding for physician services, determination of which service is initial is based on the physician or other qualified healthcare professional's knowledge of the patient's clinical condition and treatment. When codes for hydration, therapeutic, prophylactic, and diagnostic injections and infusions, and infusion of chemotherapy or other highly complex drug or biological are assigned, the initial code is assigned for the service that best describes the key or primary reason for the encounter. This is true regardless of the order in which injections and/or infusions may occur. When coding for a facility, determination of which service is initial is based on a hierarchy of services and methods of administration. For services, chemotherapy services are primary to therapeutic, prophylactic, or diagnostic services, which are primary to hydration services. For administration methods, infusions are primary to pushes, which are primary to injections. When coding for a facility, report add-on codes for second and subsequent infusions of the same drug or substance on the same date of service based on the individual time of each additional infusion. For add-on codes, the guidelines assert that add-on codes of a higher hierarchical position should not be reported with base or initial codes of a lower hierarchical position. The guidelines also indicate that this direction supersedes parenthetical instructional notes. For example, add-on code 96376, therapeutic, prophylactic, or diagnostic injection, each additional sequential intravenous push of the same substance or drug provided in a facility is primary in the hierarchy to 96360, intravenous infusion of hydration, additional 31 minutes to 1 hour. An intravenous or intra-arterial push is defined as one of two things: an injection, where the individual who administers the substance or drug is continually present to administer the injection and observe the patient, or an infusion of 15 minutes or less. For infusions where time is a factor, use the actual time over which the infusion was administered. An additional IV push code may be reported if another push of the same drug is administered 30 minutes or more after the last administration. An infusion of any type that is administered solely to keep open a venous or arterial access is not separately reportable. For continuous services that last beyond midnight, use the date in which the service began and report the total units of time provided continuously. For example, if hydration is administered from 10 p.m. to 2 a.m., code 96360 is assigned once, with add-on code 96361 assigned twice to account for the total units of time the hydration was administered. For services that last beyond midnight that are not continuous, a minimum of 2 administration codes are assigned, one to report the initial service and one to report a subsequent service. For example, if reporting for the facility, if an IV push of medication is given at 10 p.m. and another IV push of the same medication is given at 2 a.m., code 96374 is assigned to report the initial IV push of the substance or drug, and add-on code 96376 is assigned to report the sequential IV push of the same substance or drug. This represents an exception to the requirement for a new substance or drug to be administered in order to report a sequential infusion. Hydration services are reported per hour of administration. A minimum of 31 minutes of administration must elapse before code 96360 can be reported. Once 60 minutes have passed, another 31 minutes of administration must elapse before add-on code 96361 may be reported. Hydration provided before and after infusion of other substances to avoid toxicity is reportable. Do not report hydration administered solely to keep an IV line open or administered as a concurrent infusion. Hydration administrations of 30 minutes or less are not reported. Codes 96360 and 96361 are not intended to be reported by physicians or other qualified healthcare professionals when hydration is administered in the facility. Therapeutic, prophylactic, and diagnostic injection and infusion services are reported with codes 96365 to 96379. Fluids used to administer these types of substances are not reported separately, as this is considered incidental hydration. Codes for administration of these types of substances may be reported separately when provided as supportive management for chemotherapy. Administration of these substances requires direct supervision, special handling considerations, and periodic patient assessment. Injections administered without direct supervision are reported with code 96372 by facilities and evaluation and management code 99211 by physicians. As with hydration, codes for therapeutic, prophylactic, and diagnostic injection and infusion services are not intended to be reported by physicians or other qualified healthcare professionals when administered in the facility setting. Injection and infusion of chemotherapy and other highly complex drugs or agents is reported with codes 96401 to 96425. Preparation of these types of drugs to facilitate administration is not separately reportable. However, administration of medication provided as supportive management for chemotherapy may be reported. Administration of these substances requires direct supervision, special handling considerations, and frequent monitoring of the patient. As with therapeutic, diagnostic, and prophylactic injections and infusions, fluids used to administer chemotherapy are considered incidental hydration and are not reported separately. Codes for chemotherapy services are not intended to be reported by physicians or other qualified healthcare professionals when administered in the facility setting. Chemotherapy perfusion services are reported with codes for arterial infusion 96420 to 96425. Placement of an intra-arterial catheter to deliver this service is reported with a cardiovascular surgery code. Arterial and venous cannulation to facilitate extracorporeal circulation via membrane oxygenation perfusion pump is reportable with 36823. This code includes dose calculation and chemotherapy administered by injection into the perfusate. Do not report codes 96409 to 96425, injection and infusion of chemotherapy and other highly complex drugs or agents, with 36823. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review series, as well as our full catalog of courses at hialearn.com.